almost no angiogenesis at all in this particular tumor. In other words, if you went in here and you took a section through here and you were looking pathologically for angiogenesis, you may or may not even see it. And certainly if you took a fine needle aspiration from the center, forget it. There's nothing in there but necrosis. Now, this angiogenesis can be monitored serially, so the agent actually can't really detect it the next day. So you can look at it, say a tumor at 8 days, then come back at 14 days and see how it's progressed in neovasculature. So we can monitor these things. And you can see that this same rabbit looked 2 days later. You can see this area here is right there, and this area here is right there. So these aren't really random blue spots of voxels which are rich in angiogenesis. These actually are real locations that are reproducible in the same animal, and you can do this over and over again. But you can imagine, for instance, using this information to decide whether to treat someone with an anti-angiogenic or not, or if you gave an anti-chemotherapy or radiotherapy and you want to know if tumor's recrudescing, well, angiogenesis would be recrudescing, and we can go after and looking at it. And there's more, and I'll point that out in a moment. I want to switch to fluorine because I've been showing you about proton, but actually the core is fluorine. And fluorine offers a tremendous opportunity for us. One, because it has no background. Very little in your teeth, bone. So fluorine is an outstanding signal for us, nuclei for us in MRI. And it's almost as good, if you will, as proton. The other good advantage of it, unlike proton imaging, fluorine is not as affected by its environment, although there can be small changes due to temperature and oxygen. So this is an example of the particles looking here at the proton imaging and here at fluorine imaging.